different and a little older handout than the one you have in your study guide for Competency 7. But I think it kind of makes a point. So I've left it here. It shows you across the top, across the top it says when to take, starts working, which of course is the synonym for onset, works the hardest, which is the concept of peak, and then stops working, which is the duration, or how long does it last. So down the left column it gives you two of the rapid-acting insulins, which is Lispro and Aspart, or Humalog and Novolog are the brands. It tells you when to take it, the onset, peak, and duration of Humalog and Novolog. And then it gives you regular. And it gives you when it starts to work, the peak, and when it stops working. So the interesting thing now is you don't see regulars much anymore, do you? Because we have replaced it mostly with Humalog and Novolog. The nice thing about Humalog and Novolog, how long, when does it start working? How long?
5 minutes.
5 minutes. And then it peaks in 1 hour. So if you look at the difference between rapid-acting, Humalog and Novolog, and short-acting, which is regular, how long does it take regular to start working?
30 minutes.
30 to 60 minutes. So we used to tell people back in the days when they used regular, we would say, take your insulin and then decide what you're going to have for breakfast and start making it. Now we say, take your insulin and start to eat. You can basically take it and eat right away, because it only takes 5 minutes to start working. Okay, so the regular we'll still see used for insulin drips, which is in the ED, the ICU, and places where you do insulin drips. And it mentions insulin drips in the emergency management of what 2 conditions in the video? DKA and HHNC. Right, because if there's hyperglycemic emergencies, the treatment is insulin. And the other treatment was fluid, right? Okay. Now, the intermediate acting insulin that we still use, you don't see it as much in the hospital, but we still use it, is NPH. NPH is cloudy. And the reason it's cloudy is because they've added a preservative to it to make it absorb more slowly. So what's the onset for NPH insulin? 2 to 4 hours. What's the peak? It's pretty wide range. 4 to 10 hours. And duration is 10 to 16 hours. Okay? So we still do have intermediate acting NPH insulin. Now I want you to cross off Lente and Ultralente. Those were the long-acting insulins, but they've taken them off the market. Because if you look at the one below that, what's the one listed below that? Lantus. That has replaced the use of the others, so they don't make them anymore. Lantus or glargine insulin is taken once every 24 hours. Generally at bedtime, but I have seen some docs that give it in the morning. But it's only given once every 24 hours. What's the peak for Lantus? None. What's that mean? That means there's no peak. That means it gives a basal release over a 24-hour period. That has eliminated a lot of these complications like Somogy effect and dawn phenomenon, where people would get hypoglycemic in the middle of the night. Because Lantus is a basal release, recombinant DNA, newer type of insulin, and it's peakless. And then Doctors has Levemir, which is similar. So Lantus has replaced the other long-acting insulins. It's clear, and it also says, do not mix Lantus with any other insulin. Okay? Can you mix regular and NPH together?
Yes.
Yes. But you can never mix Lantus with any other insulin. And the generic name is glargine. And then there are some other mixtures, but not with Lantus. All right. So here's my NCLEX test question. The patient receives, let's give him 35 units, NPH insulin at 8 a.m. 0800. NPH insulin sub-Q, 35 units, 0800. At which time would it be best for the nurse to give the patient a a snack. All right, so there's two concepts there. It's asking you about MPH, insulin, and it's asking you about food and administration of food. All right, I'm going to give you 4 choices. So your 4 choices are 10 a.m., 12 noon, 3 p.m., or 8 p.m. I wrote it in military time as well because you know what 1500 and 2000 mean. Either way, you would be able to figure out what time it's asking. All right, so 2 concepts here. The concept of the snack. What does food do? What does insulin do to your blood sugar? Lowers it. What does food do to your blood sugar? Raises it. Okay. So the idea of giving the patient a snack, you want to give the patient a snack at the time when the patient is going to be the most what? Hypoglycemic, which is going to be at the peak of this particular insulin. Right. You want to give the snack at the peak time of NPH because that's when they're going to need food. Okay? Doesn't ask you about, whether they've had breakfast, lunch, that's irrelevant. It just wants to know about when's the best time to give food, which would be at the time of the peak of this insulin, right? Okay. So who thinks the best time to give the snack would be at 10 a.m.? Nobody. Okay, good, because 2 hours is not the peak for NPH, is it? Okay. Who wants to give the snack at 8 p.m., 12 hours after the insulin? No, we don't. That doesn't make sense either because it's not working anymore. Okay, what's it say the duration is? It's not working. Yeah, it's basically too late. Okay. So now you have 12 noon and you have 3 p.m. So it wants the best answer, just like any time you do a nursing question, right? So you have this concept of the insulin starts to work, and then you have a peak period, and then you have it sort of trails off, and then it doesn't work anymore, right? So it says 4 to 10 hours? All right, so you've got 8. So here's your peak periods. All right. So if this is 10, well, actually, let's do the peak here. This is all going to be the peak. 4 to 10 hours. 4 hours, 10 hours. What's halfway between 4 hours and 10 hours? 7 hours. 4 plus 3 is 7. 7 plus 3 is 10. So 4 hours after, 7 hours after, 10 hours after. So this is your peak range. All right, so now I'm going to ask you this question again. So who thinks the best time to give the snack would be at 12 noon? Okay, who thinks the best time to give the snack would be at 3 p.m.?
Yes.
All right, and a lot of you didn't want to vote. This is fine. But here's the point I was making. If your range is 4 hours after, say you give it at 8 a.m., this would be like 12 noon. 7 hours after 8 a.m. is what time?
3 o'clock. 3 p.m.
7 hours after 8 a.m.
3 p.m.
is 1500 or 3 o'clock. And then it stops, the peak ends, and it's not working at all by 12, 14 hours later. So what's the best answer?
3 p.m.
Best answer is 6, 3 p.m. Okay? 7 hours after 8 a.m. is 3 p.m. That's when the patient's going to be most hypoglycemic. It's going to be acting on his blood sugar from the time of the onset up through the peak range and then down to the end. But the best time to give the snack is at the peakest part of the peak, the center of the peak, if you will, because things don't go like this. Things kind of go like this. This would be your best answer. Okay? All right. So now let's go ahead and look at these. A lot of patients these days, take one and pass it down. Take one pen, pass it down. Let's see if we run out. We can always share. And then take a needle. Sort of send it down the middle. Take one needle, one pen, one needle. And then a couple of alcohol pads. 2 or 3 alcohol pads. Send them down. I'm going to need a pen too. And then, let's look at the next handout you got. You got a second handout. And it's kind of fuzzy at the top, but it says 4 simple steps for use. And it's this directions for the use of the Novolog Flex pen. Because a lot of patients now are using pens rather than drawing up insulin with their little syringes with those little mark-offs, right? Does everybody have a pen?
Yeah.
Thank you. All right, so some of you use pens already. Some of you maybe haven't. This is your chance to practice with pens. And you can send a football and take one for like 3 people and send it down. We're going to run out of footballs here. All right. Now, I understand that you've washed your hands and you're wearing exam gloves, right? All right. So go ahead now and look at your directions. 4 simple steps for use. I understand there are different kinds of pens these days. This is a particular brand of pen, and it works in a particular way. Does everybody have a pen and a needle?
No, I don't have it. I have a
One of the concepts is the pens are not disposable, the needles are. So please do not give your patient their insulin with a pen and drop the pen in the sharps. They're hundreds of dollars. I had a student do that. Instead of unscrewing the needle when she was finished and putting the needle in the sharp, she dropped the whole thing in. Hundreds of dollars. Only belongs to that patient. You can't use the A-bed pen on B-bed even if they're on the same insulin, because that's their pen and they paid for it. Okay? You also don't need to refrigerate them. You don't really need to refrigerate insulin at all. Some nursing homes still like to keep it there, I think, so everybody knows it's there. You don't share with other patients, and you don't need to refrigerate it. And it's really nice for patients that have low vision, because if they're only giving 1 or 2 units, it's really easy to see. So it says, wash your hands, take the cap off, the blue cap. And the other thing about this is don't lose the cap. Because if you lose the cap, it's going to be contaminated sitting in their drawer. So easy to say, but don't lose the cap. Okay. Now what's it say? It says to wipe the rubber stopper with an alcohol swab and screw on the needle. I guess these are the cheap needles because they don't have a needle guard, so be careful. You have to pull off the little purple paper that protects it, and then you're going to screw it on righty-tighty to the end of the insulin pen. Okay? And then at the end, we're going to take them off and put them in the sharps. But for now, screw it on nice and tight. Then you can take off, be careful, you're handling a needle, take off the outer cap, and it says performing the air shot. Remove the outer cap. Dial the dose to 2 units. You're going to dial it in the back by the plunger. Isn't that cool? Actually, you kind of have to take it off, or you won't see the. Take the little purple cap off too, and just be careful. Dial the dose to 2 units. Hold the flex pen with the needle pointing up. And with the needle pointing up, press the button. It's not an orange button. You have fake ones, I think it's white. But push the plunger till it goes click, click. And it does what? Why do you do the air shot?
Because there's air.
Because you're priming the needle, just like you would with a regular syringe. But you dial it to 2. You push it, click, click. It goes back to 0. And you may see a little drop of fluid at the end of your needle. That's a primed insulin pen needle. Okay? All right. So then you're going to set your dose. Once you've done your air shot, it goes back to 0. If you don't see anything, don't worry about it. You might have an empty one. I think your pen's empty. This video pen is not. Some of these are used up. You got an empty one too? Any other pens in there, or is that empty? I have some more pens.
Well, we could use mine when I'm done.
Just be really careful because you have an exposed needle. Where's the box of needles? Thank you. These are disposable, one-time needles. Oh, that was, yeah, this one you just gave me. All right. So let's say your patient is going to get 3
If
units
that pen has something in it, the remaining.
of
Yeah,
Novolog. One thing it won't let you do is if it's too empty, it won't let you dial anything in. It's meant so when the patient's, if the patient needs to give himself 10 units, there's only 6 left, it won't work. Because they can only give what the needle has, what the pen has. So some of these pens are getting kind of empty from use. All right, so you did your 2-unit air shot to prime your needle. Now you're going to dial in the dose that you're going to give the patient. So let's say we're going to give the patient 3 units of insulin. Let's say these are all Humalog Flex pens. Isn't that nice? See how easy it is to give 3 units? You know how hard it is to drop 3 units on those syringes? So it's 3 units. You're going to give it sub-Q, and you're going to give it sub-Q. Let's say we're going to give it in the back of the arm. You're going to give it in the footballs, but let's say it's the arm. What does it say here? It says setting your dose. Dial to the number of units you need to inject. You can turn it up and down to correct. You can't set a dose for more than the number of units left in the pen. Step 4, giving your injection. It says what? Pinch your skin at the injection site because it's sub-Q. So you're going to take your non-dominant hand and you're going to pinch up some skin, and you're going to keep that non-dominant hand there the whole time you give the injection with your dominant hand. It says, now you want to push the needle, you want to put the needle into the patient, but you also want to hold the pen close to the body. First time I did it, I didn't push it close enough, hold it in far enough, didn't hold it long enough, and when I came out, it ran down their arm. Mm-hmm. So you want to push it in nice and tight. You're going to give it like a dart, hold it in nice and tight. Reach back with your thumb or finger and give the dose. Click, 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 click. Then it says hold it for 6 seconds. 1, 2, 3, 4, 5, 6. Then come out and let go with your other hand. All right, so a sub-Q injection is done with one hand, right? It's all one hand to give the injection. Your non-dominant hand is pinching up the skin. Now, for this size needle, what degree angle do you think you're going to use? 90 degrees. You're going to have a pretty skinny person that's not going to be 90 degrees. Look how short and tiny that is. That's like a 31 gauge, teeny needle. For a lot of patients, you're giving it into fat, aren't you? But 90 degrees should be the technique. Hold it like a dart. You do not hold a syringe like this. You do not hold a syringe like this. Anybody ever played darts? Mm-hmm. I've said that over and over, and people, I don't even know what you mean, Mrs. Annie. Like this. So you don't hold it like this, and you don't hold it like this. Okay, you're going to hold it like a dart, and you use a wrist motion. Now this is a really short needle, so it doesn't need a lot of wrist motion. But you're going to go straight in, hold it tight against the skin. Reach back, give your injection, click, 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 hold it 1, 2, 3, 4, 5, 6, and then come out, and then let go with your other hand. So practice that a couple times. And then when you're finished, your needle will go into the sharps. Now, to put the needle into the sharps, what I would do is take the outer thing and set it back on there. Take the outer cap, set it back on the needle, and then lefty-loosey it, and hopefully you'll get the whole thing off like that.
Yeah, that's what I did.
Yeah. And then I'll come around with the sharps container and you can put your needles in. So you have the instructions. When in doubt, read it. It says, remove the needle, put the needle in a puncture-resistant container. And then the blue cap, the big cap, goes back on the pen goes back in the patient's drawer or Pyxis or wherever you're keeping it. Okay?
So there's one thing that it says when you're trying to recap this.
Well, with that kind of needle, the ones they have at Anne Arundel they have needle guards on them. You can't possibly stick yourself. I don't know where Miss Dias found these needles. But it's theoretically possible that you could stick yourself, yeah.
They have retractable ones.
They also have retractable ones. The newer ones now, as soon as you come out, they retract. So I'm not sure you're going to see these particular needles again. But the principles still are the same, whether you have the needle guard on it or not. The ones at Anne Arundel, you can't stick yourself with the needle. So be careful recapping that needle, only because you're going to need to recap it to put it back in the sharps. I don't want you to unscrew an exposed needle. See if you can put the cap on before you take it off. But just practice handling the stuff. I mean, you still need to learn how to handle needles. There are times when you might be handling exposed needles. You can recap it before you take it to a
big dose. Some serious blood sugar going on over there.
Injection of anything to anybody in any place.
What did you pull it at?
But just for putting these away because they're strange.
My gosh, you can give
a lot.
Yeah.
You can give a large dose. You could give a 35 units of NPH in an NPH pen. Yeah. If you see 35 units of NPH, make sure you're giving NPH, because that would be a pretty high lethal dose of regular. And that's the point. I actually had a student who did that once. Picked up the wrong pen, gave the patient 35 units of regular instead of 35 units of NPH. Guess what happened to the patient?
Oh,
Got hypoglycemic. Guess what we had to give her? D50. Did she fail? No. But it was a big lesson. Patient actually did suffer consequences. So when we talk about high alert drugs, and we use terms like HIPPO, and we're talking about joint commission, HIPPO drugs are high alert drugs. HIPPO drugs is HIPO. Drugs that we use a lot, that if you screw up and give it wrong, you kill somebody. The H is heparin, right? That's the one that Dennis Quaid's babies got the wrong dose of heparin because the nurse thought the correct dose for flushing the lines was in the Pyxis, and it wasn't the correct heparin flush. Babies bled out. I, of course, then becomes what? The one we're doing now, insulin. And the P is potassium, and the O is opioids, opiates, narcotic drugs. Okay, good. Any questions about the pens? Oh, don't put your footballs back. You're not done yet. All right. Now, you might have to share these. Take a regular and pass it down. Take a regular insulin and pass it down. Behind that, take an insulin syringe and pass it down. You can send the pens back up if you want. So you're getting regular insulin, you're getting regular insulin syringes. Now, the insulin syringes usually are orange, right? Can you give any other medication in an insulin syringe? No. They're marked off in units. You can only give insulin in an insulin syringe. You can't use a different syringe to give insulin, and you can't use an insulin syringe to give something else. They're marked off in units. Keep sending. Hopefully we have one syringe for each student. You might have to share some of the insulins. Okay. Take an NPH and send it down. You guys go that way. You guys go that way. Here's a couple more ones. And last but not least, now some of you have already been checked off doing this with Miss Diaz, right? This is just another practice, because when you get checked off, which you need to do by next Friday, you'll either do the central line sterile dressing change, or you'll do the mixed insulins with the insulin pen. Anybody need NPH? Did you run out of regulars? Does everybody have a syringe? One syringe. All right. Who wants to share their insulins? Here, you're going to share with one of the people next to you. You don't have anything?
There's an extra regular. There's an extra regular there. Is it yours?
Yeah, here's an extra. Regular. Here, will you
Everybody
pass
has
that
a
down, honey?
syringe. Everybody has access to an insulin. Let's go ahead and send the alcohol pads down again, just in case somebody needs one. And you should have a little card. I think you got the little card.
What type of insulin is regular?
So your little card is going to tell you what to do. Somebody has a little card that says 5 units of regular insulin, 20 units of NPH, right?
Mm-hmm.
Okay, so what type of insulin is regular?
It's the red one.
The one with the red
The one with the
Regular
R.
is short acting, right?
Yeah.
So you need to know the onset, peak, and duration of regular insulin, short acting insulin. And it's clear. Somebody has a 10 units of regular insulin and a 40 units of NPH. These particular insulin syringes are marked off to 50. So you can't give more than 50 units combined in this syringe. I don't think anybody has a combination that's more than 50, do they? Okay, I think somebody else maybe has like 2 and 4. 2 units of regular and 4 of NPH. Okay, you're fine. So what kind of insulin is NPH?
Long as.
As long as
Intermediate action.
Intermediate.
Not long. Long as Lantus. We're not going to mix that with anything. Okay, and it's cloudy. So if you pick it up and it's precipitated and the cloudy isn't evenly distributed, what do?
It's just a roll.
Roll it. You don't shake it because it'll foam up like protein. So you can roll it. You want to mix your NPH and get the cloudiness to mix together. Okay. Now you're going to mix your insulins and you're going to give them to your patient, your footballs. So what are some sub-Q injection sites?
The belly,
Abdomen.
the abdomen,
The abdomen,
the back of the arm,
thigh,
Triceps.
shoulder
the arm.
blades,
Triceps.
shoulder blades.
Okay, the back of the arm, yep, the triceps. Sometimes people even have back fat. If they don't, they can't really stick it in their back. But you do want them to rotate sites, don't you? Sometimes patients are happy to have you give it in the back of the arm, the triceps, because they can't reach back there very well. Okay. So, how do you mix insulin? What are you going to do first?
Yeah, to the regular.
Put air
To
into
the
the cavity.
NPH.
Okay, you're going to put air into the NPH. How much air are you going to put in the NPH?
20 units.
However much your
This-
card
this
says,
one, 4
your
units.
dose of NPH. If it says 40 units, you put 40 units of air. If it says 20 units, you put 20 units of air, etc. Right? Yep, keep it down on the table or in front of you and put the air in. Now what are you going to do?
Put the rest in the
What?
regular.
Now you're going to wipe off the regular. And what are you going to do with the regular? Put the amount of air in the regular that you have as your dose. You'll have different cards.
Excuse me.
Which insulin are you going to draw up first?
Regular.
The regular. That's your end class
Regular
question. Which insulin do you draw up first? The answer is the regular.
In your statement somewhere you say, after we draw, we put air in the other one, but you can't put air with the same syringe.
Of course you can.
Drawn one.
Of course you can.
After I've drawn one, I can
Sure.
put air in the other one.
Wipe off the MPH, put the air
You
in.
don't
Wipe
go-
off the regular, put the air in.
No,
You only
I think
have
what
one.
she's
You're only
saying-
going to use one syringe.
You don't
What
draw.
she's saying, you don't
Just
draw.
put air
You
in.
put air in the
Put
pH,
the air in.
and then
I
you
don't
take
even
it out.
really care in the real world if you put the air in. Just make sure you draw the regular up first, and then the MPH. But you got to. But the way we're teaching you, if you're doing this Nancy Reagan registered nurse thing, you're putting the air in the MPH and taking your needle out, and then you're wiping off the regular and putting your air in the regular, and then you're drawing up your regular. Now you can play in the regular. You can draw up more than you need and push it back up to get rid of your air bubble, right? So you're drawing up your regular first. You're only going to use one syringe. So if you want to put the air in the NPH first, that's fine. But then you're going to put the air in the regular and draw it up. Why do you drop the regular first?
Because you don't want to mix it with these.
Because you don't want to get any NPH into your regular and vice versa. Okay, so you're going to drop your amount of regular. And then you're going to look at your partner, your other licensed person, and what are you going to say?
Check it for me,
Check
please.
for me.
You're going to say, could you check this? What do you see?
What do you see?
You're not going to say, do you see 5 units of regular or 10 units of regular? You're not going to lead them. You're just going to say, what do you see? And all they can, and you're going to hold the insulin with
What
it.
do you say?
You're going to hold up your vial of insulin with it. Did you hear what I just said? I said, hold up your vial of insulin with it. He doesn't know what he's looking at unless you hold it up.
It's my order.
See what?
You can show him the order.
4 plus 2 is 6.
Yeah, that's fine. He's ready.
Okay.
That's fine. And then all you can say is, I see 6 units
I
of
see the
insulin.
same
Yeah.
thing that you did. Okay.
Now, if you drop the regular first and show it to somebody, then you're gonna pull your NPH, right?
Yes.
And once you pull both
What
of
you
them,
see
you're going to have
it.
the combination
No,
of
it's
both
under the
on
film.
in your syringe.
The 5 is the one with long line.
It's
It's
gonna look
6
cloudy
units.
because you
6
fixed
units.
in the
I'm wrong.
NPH also.
Regular. I should have 5
If you pull up too much NPH, can you put it back in?
No.
No, you have to start over. So you have to, like I said, you can play with the regular, make sure you got the right dose. But then on the insulin, on the MPH, all you do is put it in and pull it up until you get the combination of both.
Should be 5.
What do you see?
So I had a student once, I don't mention names, but instead of pulling up 2 of regular and 4 of insulin, They pulled up 20 of regular and 40 of NPH. 2 and 4 is not the same as 20 and 40. Make sure you're careful and you're reading your syringes carefully. So if you had 2 plus 4, you now have 6. If you had 5 plus 20, you now have 25. If you had 10 plus 40, you now have 50.
What do you see, my dear?
What do you see?
Fine.
Then you're going
Let
to
me
take
see.
your syringe to your
Is
patient.
that like 11?
Tell them what you're going to do and give
Okay.
them their
Oh, I'm
insulin.
sitting down. Yeah.
Sub-Q. Now,
Sorry.
these little needle caps are actually flat. So before you go, are you going to walk down the patient's hallway like this?
No.
No. So I would actually put this flat, put this in, and then take it this way. Okay? After you give the patient the injection, then you would never, ever, ever recap. And some of these syringes now have a vantage point, or they have a needle guard. These don't. I guess we're buying the cheap
So
ones.
there is 20 of that.
But after you give it, you're going to have to put it right in the sharps. Okay? So go ahead and share your footballs and give your insulins. These are mixed NPH and regular insulin. Thank you. Yes, there are also sharp boxes and patients.
4, 5, 6. There you go.
Time practice. Get comfortable with pinching up the skin with your left hand. I still see students who let go of the needle. Patient doesn't want to look down and see a needle sticking out of his arm with you not holding it. It's a one-handed technique. One hand. Pinch up, put it in, give the injection, hold 1, 2, 3, come out, and then let go. One hand. You have to manipulate it and give it with one hand. Don't let go and try to aspirate. We don't aspirate sub-Qs. We don't aspirate, we don't massage, we just give it. Most of those needles for insulin are so small, I generally always go 90 degrees. If you have a really tiny person, you can do 45, that's fine. But you don't want to give it intradermal, you want it to be sub-Q. So practice. Practice so you're comfortable. Okay, let me see you give the injection. Okay. I see
Where's yours?
50 units, and I see your order, and that's correct.
Somebody, the
Because
person
I'm
who
looking at the
uses
order.
myself.
Okay, go ahead and give them the injection.
Yeah, some mess up on mine too.
Right-handed.
So you've done. You're done with yours. You threw the insulin.
Really? That's my school fee. You for that one?
It's not a number of
What did you
seconds,
say?
it's how much volume you're giving. Yeah,
Five.
those people who have
I
6
think-
units
wait,
don't
is there
have
an air
as much to
bubble?
give as people who have 15.
Yeah,
I
there
think
is.
so. There is.
You don't understand, they're all.
Put it back in and then just drop more and then squirt it
If it's
out.
slow enough that you've got good control and you're pushing it in, but not, it's still going to go in 5 seconds or so. With one hand.
It's mixed.
Pinch the skin up until you come
If you
out,
flick it
and then you
up
can let
like
go with
this,
your other
and
hand.
so- let me see.
It's 5. But did you see something?
You want to draw it up again? You're welcome to do that.
No, looks good now,
You
but
feel comfortable.
did someone
You
mix
did?
up your thing?
See, that's what I'm saying now.
Somebody
Because
put
I'm using the
something,
same
do we have a
thing.
regular that looks cloudy?
No, this one's clear. Why does this look cloudy?
That's what I'm saying. I'm using the same
Some people probably put NPH into the regulars. You're not supposed to be. If it looks cloudy, somebody's messed with it.
It is.
The NPH is supposed to be cloudy. Nice, it has a big green N
This
on it.
one up
What does
first,
the N
right?
mean?
Okay.
It means NPH. It has a great big orange R on it. What does the R mean?
Regular.
I don't assume anything. I learned that the hard way. Is that 2 plus 4? The 2. It's hard to do.
25.
Pull it up to about 5 and then
Looks
go 4, 3, 2.
lovely.
Pull it up
Thank you.
past 2. Or you'll end up with an air bubble. Pull it up past 2. The regular you can play. Pull up to like 5 and then go 4, 3, 2. See how much easier it is with a pen to give 2?
Use.
The patients feel the same way. especially if they have some mobility issues and some visual issues. When you're pulling out of a vial, hold it eye level. That's good. There's usually a little place, an opening where you can see to the side that your needle's already in, all the way in. But these are very short needles, so you're not likely to pull up air. Unless your vial's almost finished, and some of them aren't. Keep practicing till you're comfortable with drawing out of a vial and giving a sub-Q injection. Okay? Because that's really all we're going to do. And then if you get the pen or the mixed insulin for your skill, you'll be set to go. Because we haven't missed any labs. The poor thirsty people are going to miss another one.
Oh my.
Put this, do you have this
And our
stuff back
clinical.
over here?
Yes, thank you.
So we are good now. Okay.
I know. I will do 8 inches and
Yeah, I already. That was the same way I tried. Oh. Was this one? No, yeah, that one is. Yeah, this one.
Where is?
You use this.
I want this.
So these are just practice pens. There's just saline in them. Thank you. If you're finished with your insulin, you can bring them back up here, and you can pack up and go.
Thank you.
Was that helpful to handle? The more you handle these things, handling the pen, giving the pen, substitute from the pen, handling the syringes, mixing the insulins, and giving the substitute from the syringe. And then you can just bring your insulins back up front. I'll collect footballs. We have all these fancy injection pads, but I still think footballs work as well as anything. They seem to hold more.
I like how
Thank you.
easy and